David, let me first say it's really an honor to be part of this ceremony welcoming the incoming Montgomery County leadership. This is an amazing place. I've lived a lot of places, and this really combines a lot of the things that I've loved in some of the other places I've lived, like Silicon Valley and Boston. And actually, one of the things that it has in common with where I grew up is in Boston. I used to go all the time to the Boston Museum of Science. And so when I watched this movie, I saw myself. And I thought, it's kind of relevant to tell you a little bit about my journey and what I'm doing now, because is there anybody in this audience who's interested in a cure for cancer?
Yes.
There is. Okay, good. I'm going to tell you how it'll be cured. And I think it's going to be cured right here in Montgomery County. I hope by American Gene Technologies. I think we are in a leadership position here. But it's going to be cured by gene and cell therapy, and that's a slam dunk. And guess where the epicenter is of gene and cell therapy? It's right near the NIH, exactly where you'd expect it to be, in Montgomery County. And I think that this bodes well for an amazing future economically here. Hold on to your houses, because if it's anything like Silicon Valley, and I think it could be, your houses are going to go up by a factor of 4 to 10 over the next decade or so. But it's all going to boil down to this. You guys are probably familiar with viruses. And viruses have been around for about 1.5 billion years, reprogramming your cells to do bad things. Well, it turns out that a technology that actually came out of the study of HIV, partially, gave us what's called a viral vector. We can actually crack open HIV, we can scoop out AIDS and throw it away. And then we can use all the good parts of HIV that deliver new genetic material to your DNA to do what? To create updates for the human computer that make it run better. The cell is so much like a computer that, in fact, as we're learning to go in there and add genetic material to adult human beings and to make their cells work better, you might ask, what can we do? The answer is more like, what can't we do? We can go ahead, and if you have an inherited disease, we could replace a gene. So that broken gene in you could actually be replaced or edited to be normal. And instead of suffering for your entire life with the symptoms of that inherited disease, you would return to normal. You would achieve a quality of life that is just normal. But we can also turn cells into little bots that can do almost anything around your body. And that's what CAR T is. How many people here know about CAR T? It's amazing how few. But there is a technology that repurposes T cells from a patient to go after all of their cancerous B cells, wipe them clean, and it is providing a 90% cure rate to a terminal, completely untreatable form of blood cancer. That is the future of cancer. How are we doing it? Let me just tell you real quickly, it's simple. T cells can destroy anything. CAR Ts take T cells and reprogram them to go after something new. Turns out you have natural T cells that are eliminating epithelial cancers as I'm talking to you right now. Small occurrences of epithelial cancers are being detected by gamma delta T cells. And the only reason that you can get a deadly cancer is because when you get a critical mass, it starts growing like a balloon. And the surface area gets too large and your immune system can't handle it. Well, we can put an injection of a virus just into the primary tumor. It starts secreting, well, you could think of it as like a perfume that attracts those T cells. But it actually attracts them, trains them, stimulates them, it acts like a vaccine. It doesn't just clear that tumor, it clears all the epithelial tumors in your body, even undetectable ones. We have a 1,000-mouse study that's showing an 85% complete remission. Now, people that have been in this, well, thank you. So that's why I'm so excited. And, I think that we're not the only ones in this industry. Gene and cell therapy will address 6,000 to 7,000 monogenic diseases in the future. We're using it to cure HIV. We expect to be in the clinic next year with an HIV cure. It's a one-time treatment for an HIV-infected individual, makes them immune to HIV, including their current HIV, for life. They return to normal, no more drugs, no more treatment, no more side effects, no more dealing with the enemy within, vanquished forever. But this is all within the reach of a technology that is driven by what? Creativity, problem solving, and affection for science, technology, engineering, and math. And our logo was designed by an artist, so we support STEAM as well. So I'm so excited to see a place like the Kid Museum. We were so glad to, help sponsor this event and support this. I know how valuable it is. I can go right back to those days as a 10-year-old in the Science Museum in Boston. That was what got me curious about what works and how to make things work and how to solve problems, and got me all excited and inspired about this. And Montgomery County is a natural place for this and a great place for AGT, and we're looking forward to making this our home for the long term. Thank you.